Earlier this month, Chicago began seeing a slight uptick in COVID cases. Top Chicago public health officials say that the BA2 Omicron subvariant will be making up most of Chicago cases by the end of the month. But how does the subvariant compare to the BA1 that set records in the city? Joining us with an answer to that and much more is Dr. Richard Novak, the head of Division of Infectious Diseases at UI Health. Dr. Novak, welcome back. So the Chicago Commissioner of Public Health, Dr. Allison Arwady, says that this current increase in cases isn't quite cause for alarm with this subvariant. What's your take?
I think that she's probably right. I'm hopeful that she's right. This variant is a bit more contagious than the BA1 variant. It's about 30% more contagious. We're hopeful that people who have been vaccinated and boosted will still have a reasonable protection against this variant as well. People who have had Omicron infections already are also somewhat protected from this one as well. So hopefully it won't turn into the same thing that Omicron did.
How is this subvariant, how does this one compare to its parent variant, the Omicron variant that we know so much about at this point?
Well, as I said, it's about 30% more contagious. We do have information from Europe that shows that people who have been exposed to Omicron are much less likely to get the BA2 variant, although it's not impossible. There are rare cases of people getting a second infection. Mostly it's in people who are unvaccinated. We also know from European studies and some studies here that people who have been vaccinated and boosted do have immunity against both Omicron and the BA2 variant. I hasten to add that the immunity seems to be a little less against the BA2 variant than the BA1 or the original Omicron. That might be what's contributing to the idea of giving a second booster at this stage.
Now, you've mentioned it, but we know that it's been surging in other countries, in Europe and Hong Kong. Are those other nations? What indication do we have about how what's happening there, how it might impact us here?
Yes, well, a lot of it has to do with the degree of vaccination and level of immunity in the community. So we know in the United States, the level of immunity is considerably higher than in some Asian countries. And so we're hopeful that we won't see much of a bump here. We had a big wave of Omicron, and so immunity to Omicron is contributing to a lot of the relative immunity against the BA2 variant. But I think what we're seeing some increases now, and it's going to be mostly in people who are unvaccinated. But there's a concern that your immunity might wane, particularly if you were vaccinated 4 to 6 months ago. And so increasing immunity might be useful, particularly for people who are at higher risk.
So we know that breakthrough infections were pretty common with that first wave of Omicron. How well do the vaccines stand up to BA2? You've talked about the possibility of a second booster. So what do we know here?
Yeah, well, the immunity does work well against Omicron and also BA2 with the existing vaccines, but immunity wanes, and particularly after 4 to 6 months after the last dose, there's a greater risk of getting an infection. Hopefully the infection will be mild, and we do know that the vaccines do protect people from having serious illness that would put them in the hospital. But immunity does wane, and it's a little less effective against the BA2 variant than it is against the original Omicron. And so there's been an increasing interest in the idea of giving a second booster.
Are we expecting any guidance from the CDC on that?
Well, yes and no. I mean, the truth is that the CDC is going to make an announcement that it's basically, they're not endorsing a second booster. They're okay with people who are at greater risk getting another booster. And the reason they're hesitant is because there's not a lot of research yet on a second booster. The little that we know is based on studies done in Israel, which showed that the immunity did improve dramatically with another boost. But and we do know that when you give an additional boost, you get better titers against Omicron and in turn against the BA2 variant, although there's very little information about that. And frankly, we don't know that that translates into a lower risk of infection, although it's likely that that's true. But any hesitancy by the CDC to make a recommendation is because we just don't have a lot of proof yet.
So Chicago, we know that the city is planning to roll back some parts of its at-home vaccination program. The gift card incentives, mask and vaccine requirements in public places have been rolled back. Are there any concerns? Do you have any concerns that some of these rollbacks might contribute to our next spike?
Well, yes, frankly, I do. I think that we run the risk of having an increase in cases as we roll back protections. And this is a moving target. We won't know until more time passes if those recommendations have to change. Everybody's hopeful that we're not going to have much of a problem with the BA2 variant and we can go about our lives. But things could change and we may have to backtrack again. Let's hope that doesn't happen.
Fingers crossed. Dr. Richard Novak at UI Health, thanks again for joining us.
It's my pleasure. Thanks for having me.